Hello, welcome to Mednerds. Today, we're diving deep into the NEET PG examination, the gateway to your postgraduate medical dreams in India. Whether you're an intern just starting out, a final year student planning ahead, or a doctor looking to improve your rank, this video is your complete blueprint for success. NEET PG isn't just an exam, it's a battle of strategy, consistency, and smart work. Thousands of doctors appear every year, but only the well-prepared ones secure their dream branches in top colleges. So grab your notebook, pause if you need to, and let's build your path to that MD or MS seat. This is Mednerd, and this is your ultimate NEET PG guide. NEET PG stands for National Eligibility Entrance Test for postgraduate courses. It's the single entrance examination for admission to MD, MS, PG diploma and DNB courses across India. Key facts: it's conducted by the National Board of Examinations in Medical Sciences. NBE-MS frequency is once a year, usually January. Mode is computer-based test. Duration is 3 hours and 30 minutes. The exam consists of 200 multiple-choice questions. Each question carries 4 marks, so total marks are 800. Marking scheme: this is critical. Correct answer gives +4 marks. Incorrect answer gives -1 mark. That's negative marking. Unattempted questions get 0 marks. So if you attempt a question wrong, you not only lose the 4 marks, but also lose 1 additional mark. This means guessing randomly can destroy your rank. The questions come from your MBBS curriculum. All 19 subjects are included. But they're not equally distributed. Some subjects carry more weight than others, and we'll discuss that in detail later. Who can apply? Eligibility criteria. You must have an MBBS degree or provisional MBBS pass certificate. You need a permanent or provisional registration certificate of MBBS qualification issued by MCI or State Medical Council. You must complete 1 year of internship or be likely to complete before March 31st of the exam year. Important dates to remember: application form release is usually September to October. Last date to apply is October to November. Admit card release is in December. Exam date is January, first Sunday usually. Result declaration is within a month of exam. My advice: don't wait for the notification to start preparing. By the time forms are out, you should already be in revision mode. NEET PG covers your entire MBBS syllabus. Here's how the subjects are weighted based on previous year patterns. High-yield subjects, the Big Four. Medicine has 30 to 35 questions. This includes cardiology, neurology, gastroenterology, respiratory, and nephrology. This is the heaviest subject. Surgery has 25 to 30 questions. General surgery, orthopedics, and basics. Trauma and emergency management are favorites. Obstetrics and gynecology has 20 to 25 questions. High yield for scoring. Obstetrics emergencies, contraception, and oncology are important. Pediatrics has 15 to 20 questions. Neonatology, growth and development, and infectious diseases are key areas. Moderate yield subjects include pharmacology with 15 to 20 questions. Focus on drug mechanisms, adverse effects, and contraindications. This is extremely scoring if you know it well. Pathology has 15 to 18 questions. Robbins is the Bible, but for NEET, Harsh Mohan or notes suffice. Focus on classification and diagnostic features. Microbiology has 12 to 15 questions. Lab diagnosis is crucial. Staining methods and culture media are important. Forensic medicine has 10 to 12 questions. Very predictable and scoring. Post-mortem findings, injuries, sexual offenses, and toxicology are key. SPM or PSM has 12 to 15 questions. National health programs, know them well. Vaccination schedules and epidemiological formulas are important. Anatomy has 10 to 12 questions. Clinical anatomy is preferred. Embryology, especially congenital anomalies and neuroanatomia, are important. Physiology has 10 to 12 questions. Applied aspects are asked. Clinical correlation is key. Biochemistry has 10 to 12 questions. Metabolism, enzymes, and molecular biology are important. Clinical biochemistry and genetics are key areas. Lower yield, but important subjects include ophthalmology with 8 to 10 questions on common conditions, surgeries, and refraction. ENT has 8 to 10 questions on common ENT diseases and surgeries. Psychiatry has 8 to 10 questions on classification, drug side effects, and common disorders. Dermatology has 8 to 10 questions on common skin conditions, state Ds, and drug reactions. Orthopedics has 8 to 10 questions, often counted under surgery. Fractures, bone tumors, and arthritis are important. Radiology has 5 to 8 questions on X-ray interpretation, CT, and Minster eye basics. Anesthesia has 5 to 8 questions on basics, emergency anesthesia, and drugs. Total is 200 questions and 800 marks. Timing is everything in NEET PG preparation. Here's my recommended approach. For final year students, start at the beginning of final year, that's 18 months before exam. Use final year to build strong concepts in medicine, surgery, OBG, and pediatrics. These are your clinical subjects and highest yield. Don't ignore your final year exams. Good marks help in confidence. For interns, start in the first month of internship. That's 12 months before exam. Internship is your golden period. You're seeing patients daily. Correlate with theory. Use clinical postings to understand practical aspects. Start with high-yield subjects during lighter postings. For repeaters or doctors, start immediately after deciding to give the exam. You need 6 to 8 months of dedicated preparation. Focus on weak areas first. Take more mock tests to improve speed. The ideal preparation duration. Minimum is 8 to 10 months of serious study. Ideal is 12 to 14 months. Optimal is 18 months for top 100 ranks. Why start early? NEET PG is not about cramming, it's about retention. You need 3 to 4 complete revisions. Mock tests need time to show improvement. Last-minute stress reduces performance. My strong advice, if you're in second year or third year, start reading standard textbooks now. Build concepts. Don't wait for final year. Let me break down a 12-month preparation plan. You can adjust based on your timeline. Phase 1 is foundation building in months 1 to 6. Months 1 to 2 cover basic subjects plus high yield. Anatomy, physiology, biochemistry, pharmacology, pathology, microbiology. These are your pre- and paraclinical subjects. Read from standard textbooks or trusted notes. Months 3 to 4 cover clinical subjects Part 1, medicine and pediatrics. These require deep understanding. Months 5 to 6 cover clinical subjects Part 2, surgery including orthopedics, OBG, SPM or PSM, and forensic medicine. During Phase 1, read one subject at a time completely. Make your own notes or annotate existing notes. Don't worry about memorizing everything. Focus on understanding concepts. Phase 2 is integration and first revision in months 7 to 9. Month 7. Start first revision of all subjects. Use your notes, not heavy textbooks. Focus on high-yield topics. Month 8. Continue revision. Start subject-wise tests. Identify weak areas. Month 9. Complete first full revision. Start previous year question solving. Begin full-length mock tests, 1 per week. Phase 3 is intensive revision and mock tests in months 10 to 12. Month 10. Rapid revision of all subjects, 2 to 3 mock tests per week. Analyze every mistake thoroughly. Month 11. Final revision of short notes. Daily mock tests. Focus on speed and accuracy. Month 12, the last month. Only revision, no new topics. Grand tests every alternate day. Work on exam temperament. Consistency beats intensity. Here's a realistic daily plan. For regular preparation, 12 months before, Morning session from 6 a.m. to 10 a.m. is 4 hours. Fresh mind equals tough subjects. Medicine, surgery, or new subject reading. This is your most productive time. Break for 1 hour. Late morning from 11 a.m. to 1 p.m. is 2 hours. Review previous day's topics. Solve 50 to 100 MCQs. Note down mistakes. Lunch plus rest for 2 hours. Afternoon session from 3 p.m. to 6 p.m. is 3 hours. Second subject of the day. Lighter subjects or revision. Pharmacology, pathology, microbiology. Evening break for 1 hour. Evening session from 7 p.m. to 10 p.m. is 3 hours. MCQ practice. Previous year questions. Online test series. Total is 12 hours of productive study. For intensive preparation, last 3 to 6 months, 6 a.m. to 10 a.m. is revision of 2 subjects. 10 a.m. to 11 a.m. is breakfast plus break. 11 a.m. to 2 p.m. is mock test. That's 200 questions timed. 2 p.m. to 3 p.m. is lunch. 3 p.m. to 6 p.m. is mock test analysis. This is critical. 6 p.m. to 7 p.m. is break. 7 p.m. to 10 p.m. is weak subject revision. 10 p.m. to 11 p.m. is quick revision of day's learning. Daily targets you should aim for. During reading phase, aim for 50 to 100 pages of notes or books, 100 to 150 MCQs solved, and 2 subjects touched. During revision phase, aim for 2 to 3 subjects revised, 200 to 300 MCQs, and 1 previous year paper covering 10 years. During final phase, aim for 1 full mock test with 200 questions, complete analysis of mistakes, and rapid revision of 5 to 10 topics. The 3-subject rule. Every day, touch at least 3 different subjects. This prevents monotony and improves retention. How to study smart, not just hard. 1. Active recall method. Don't just read passively. After reading a topic, close the book, explain it to yourself, write down key points. This improves retention by 80%. 2. Spaced repetition. Revise a topic after 1 day, then after 3 days, then after 1 week, then after 1 week, then after 1 month. Use apps like Anki for this. 3. The Feynman technique. Pick a concept. Explain it in simple words, as if teaching a junior. Identify gaps in your understanding. Review and simplify. 4. Mnemonics and memory aids. Create your own mnemonics. Use visual memory. Connect concepts to clinical cases you've seen. 5. Clinical correlation. Every time you read a disease, think, have I seen this? Connect theory to patients. This is how NEET PG questions are framed. 6. MCQ solving strategy. While solving, read the question carefully. They love to trick you. Don't look at options immediately. Think of the answer first, then match with options. This prevents confusion. After solving, whether right or wrong, read the explanation. Note down new facts. Revise related topics. Maintain an error notebook. 7. Image-based learning. 30 to 40 questions are image-based. Study radiology images, pathology slides, and clinical photos. Use apps and online resources for image banks. 8. Group study, selective. Good for discussing difficult topics. Quiz each other. Share mnemonics. But don't waste time. Keep it focused. Subject-specific strategies. Medicine. Focus on clinical scenarios. Learn diagnostic criteria by heart. No treatment algorithms. Cardiology and neurology are heavy. Harrison is reference, but notes are sufficient. Surgery. Operative surgery is important. No indications and contraindications. Trauma management is frequently asked. Schwartz for reference. OBG. Obstetrics emergencies are high yield. No stages of labor and complications. Contraception methods in detail. Gynecology oncology protocols. Pediatrics. Neonatology is crucial. Growth and development charts. Vaccination schedule. Common pediatric emergencies. Pharmacology. Most scoring subject if prepared well. Focus on mechanisms of action, adverse effects and drug interactions. Specific antidotes. Lippincott or Katsung for reference. Pathology. Robbins is the Bible, but for NEET, Harsh Mohan or notes suffice. Focus on classification and diagnostic features. Pathology images are frequently asked. Microbiology. Lab diagnosis is crucial. Staining methods and culture media. Disease associations with organisms, JAWETs or notes are sufficient. Forensic medicine. Very predictable. Post-mortem findings. Injuries and their patterns. Sexual offenses and laws. Toxicology. Specific symptoms and antidotes. SPM or PSM. National health programs. Know them well. Vaccination schedules. Epidemiological formulas. Biostatistics basics. Anatomy. Clinical anatomy preferred. Embryology, especially congenital anomalies. Neuroanatomy, tracts and lesions. Histology, identifying features. Physiology and biochemistry. Applied aspects are asked. Clinical correlation is key. Don't spend too much time on pure theory. What score gets you? What branch? Here's the reality check based on recent years. Score to rank conversion. Approximate 600 plus marks gets you top 100 rank. This means clinical branches and top colleges. General medicine, pediatrics, orthopedics, radiology, dermatology, MS general surgery. 550 to 600 marks gets you rank 100 to 500. This means good clinical branches. Top colleges for DNB. Medicine, surgery, OBG, pediatrics and good colleges. 500 to 550 marks gets you rank 500 to 2000. This means clinical branches in decent colleges. DNB in good hospitals. May get radiology, dermatology in lower preference colleges. 450 to 500 marks gets you rank 2000 to 5000. This means paraclinical branches. Pharmacology, pathology, microbiology. SPM, anatomy, physiology, DNB clinical branches. 400 to 450 marks gets you rank 5000 to 10,000. This means non-clinical branches. Biochemistry, forensic medicine, DNB in peripheral hospitals. Below 400 marks may not get MD or MS PG diploma courses. Need to improve or consider next attempt. Subject-wise seat availability. Most competitive with high cutoff includes radiology, dermatology, general medicine, orthopedics, and obstetrics and gynecology. Moderately competitive includes general surgery, pediatrics, ophthalmology, and ENTE. Less competitive includes pathology, pharmacology, microbiology, CEPM, anatomy, physiology, biochemistry, and forensic medicine. My advice: choose branch based on interest, not just prestige. A happy pathologist is better than a frustrated surgeon. Recommended study material. Standard textbooks for reference. Medicine uses Harrison and Hutchinson. Surgery uses Schwartz and Bailey and Love. OBG uses Williams and Shaw. Pediatrics uses Guy and Nelson. Pharmacology uses Katsung and Lippincott. Pathology uses Robbins and Harsh Mohan. Microbiology uses JAWETs and Ananthanarian. SPEM uses Park. Forensic uses Reddy and Parikh. Anatomy uses Grays and BDC. Physiology uses Guyton and Ganong. Biochemistry uses Harper and Vasudevan. Popular notes and guides include Marrow Notes, DAMS Notes, Prep Platter Notes, and Basha Notes. Test series: you must join at least one. Marrow, DAMS, Prep Platter, DBMCI, and Basha. Previous year questions: solve last 10 years minimum. Last 5 years multiple times. Anki online resource, Ankle resources for difficult or damn repeating. For spaced repetition, YouTube for spacing, repeating, patterns. Don't fall into these traps. 1. Starting too late. I'll start after internship is dangerous. I have 3 months. That's enough. Only if you've studied before. 2. Ignoring negative marking. Random guessing will destroy your rank. Attempt only if 50% plus sure. It's better to leave questions than get negative marks. 3. Reading too many books. Stick to one source per subject. Multiple books equals confusion. Revision is greater than new reading. 4. Not taking mock tests. Theory without practice is useless. Start tests early, not in last month. Analyze every test thoroughly. 5. Comparing with others. Everyone has different pace. Focus on your improvement. Don't get demotivated by others' scores. 6. Ignoring weak subjects. We tend to avoid what we don't like. Weak subjects can improve rank significantly. Give extra time to weak areas. 7. Inconsistent study. 12 hours one day, 2 hours next day is bad. Consistent 8 to 10 hours daily is better. Make a schedule and stick to it. 8. Neglecting health. No sleep, junk food, no exercise. You need physical and mental fitness. 6 to 7 hours sleep is non-negotiable. 9. Last-minute new topics. Last month is for revision only. Don't start new subjects. Don't panic read new books. 10. Ignoring instructions. Read exam instructions carefully. Practice with same interface as actual exam. Know the rules about rough sheets, breaks, and so on. The final 3.5 hours. Before exam, sleep well the night before. Light breakfast. Reach center 1 hour early. Carry admit card, ID proof, and photo. Don't discuss syllabus with others. It creates panic. During exam, time management. 200 questions in 210 minutes. That's roughly 1 minute per question. Some questions take 30 seconds, others 2 minutes. Don't spend more than 2 minutes on any question. My recommended approach, round 1, first 90 minutes. Solve easy and medium questions. Mark difficult ones for review. Don't guess randomly. Target 120 to 130 questions attempted. Round 2, next 60 minutes. Come back to marked questions. Attempt if you can eliminate 2 options. Still unsure? Better to leave. Target 30 to 40 more questions. Round 3, last 30 minutes. Review all attempted answers. Check for silly mistakes. Attempt remaining only if you can make educated guess. Final check of marked answers. Critical tips. Read every word of the question. Look for words like except, not, most likely, least likely. Don't change answers unless 100% sure. First instinct is usually correct. Stay calm if initial questions are tough. They balance the paper. After exam, don't discuss answers with friends. It creates unnecessary stress. Focus on next steps. Results usually come within a month. After you get your rank. Types of counseling. 1. All India Quota, or AIQ. That's 50% seats. Conducted by MCC. Open to all India rank holders. 2. State Quota. That's 50% seats. Conducted by respective states. Usually for state domicile holders. 3. Deemed universities. Separate counseling. Higher fees. 4. Armed Forces Medical Services, or AFMs. Separate process. Bond required. Documents needed. NEET PG admit card and scorecard. MBBS degree certificate. Internship completion certificate. Permanent or provisional registration certificate. Category certificate if applicable. ID proof and photos. Counseling strategy. Research colleges thoroughly. Consider branch greater than college greater than location for most. Check bond conditions. Look at stipend amounts. Infrastructure and patient load. Academic atmosphere. Multiple rounds. Round 1, 2, mop up, stray vacancy. Don't settle in first round if you can get better. But don't be overambitious and lose a seat. Listen carefully. NEET PG is tough, but you are tougher. Every doctor who practices today has gone through this. You can too. Remember these points. 1. It's a marathon, not a sprint. Consistency over intensity. Daily progress compounds. Don't burn out early. 2. Your rank doesn't define you. A rank of 1,000 versus 5,000. Both become doctors. Branch can be changed later through SS or DM. Many successful doctors didn't get their first choice. 3. Failure is not final. Many toppers are repeaters. Learn from mistakes. Come back stronger. 4. Support system matters. Talk to family about stress. Find a study buddy. Join positive online communities. Avoid negative people. 5. Believe in yourself. Self-doubt is your biggest enemy. You've cleared MBBS, you're capable. Positive mindset improves performance. 6. Balance is key. Study hard, but rest well. Eat healthy, exercise a bit. Keep hobbies alive. Reduced but not zero. 7. The bigger picture. You're becoming a specialist. You'll save lives. This struggle is temporary. The degree is forever. My personal advice: don't chase ranks, chase excellence. If you know your subjects well, ranks will follow. Focus on becoming a good doctor, not just getting a good branch. And remember, the best doctors aren't necessarily those who top NEET PG. They're the ones who care for patients, keep learning, and maintain integrity. You've got this. So that's it, future specialists. Your complete NEET PG roadmap, from the first day of preparation to getting that MD or MS degree. Let's quickly recap what we covered. Complete exam pattern and syllabus. Subject-wise weightage and strategy. 12-month preparation plan. Daily schedules and targets. Score versus rank analysis. Best books and resources. Common mistakes to avoid. Exam day strategy. Counseling guidance. This is your blueprint. Now it's your turn to execute. Action step. Comment below with your preparation stage, just started, 6 months in, or final month. Let's build a community of motivated doctors. Next video, I'll be covering last 30 days strategy for NEET PG. Subscribe and hit the bell icon so you don't miss it. Remember, at Mednerds, we believe every doctor deserves the best guidance. Share this video with your batchmates, juniors, and anyone preparing for NEET PG. Let's help each other succeed. This is Mednard, signing off. Go ace that exam, future specialist. Hello and best of luck.